So name of this workshop or masterclass, I should say, tonight is Healing Stubborn Back Pain for Good in Your 50s and Beyond Without Nasty Pills, Scary Injections, or Risky Surgery. So this is me and my lovely wife, Sarah. We are the founders of Balance Within Physical Therapy. We've been open for 10 years and we've been serving our community throughout that time. And it's been such a pleasure, such an honor to be able to help people in our community locally and even the ones who come a far distance for our care and for their outcomes with being a part of our organization. We are so grateful for our entire community at this organization. It is just the best. I am so grateful to be a part of this. Quick housekeeping items. As you know already, this is being recorded. So if you have any questions throughout the presentation, if you have a question you don't want to forget, please put it into the chat. Otherwise, at the end, we'll have time for a Q&A with it. If you don't want your face to be shown on the replay, it shows a few of the boxes with it. You can always turn off your camera. Make sure the mic is muted just to minimize any background noise or any distraction noises with it. If I hear some stuff, sometimes I can go back on there and mute someone, but I have to kind of pull back the other screen with it. So if you can keep it on mute, that's a huge assist. So thank you. And really, this evaluation or this class is not more for an evaluation standpoint. This is for informational purposes. But the thing is, these are oftentimes the missing links that are oftentimes missed from previous therapies or other plans of care, other surgeries with it. So this is really a good informational sharing thing to gather this information with it. But each person is going to have their different specific imbalances with their body. That one may apply to one person or may apply generally across the entire board. But sometimes those particular individual points of one person's body specific imbalances will sometimes be the complete difference maker in their plan of care. So and then at the end, we have a raffle coming up for a free 55-minute treatment session for those who attend to the end of it. So stay tuned. And then a quick bit about us, why we're doing this. As I mentioned, we've been open for 10 years. So we're approaching our 10-year anniversary in December. We opened in 2015 with the goal of being able to provide better solutions for overcoming, whether it be low back pain or just missing pieces for a lot of people's plans of care, really getting people back to just active lifestyles and giving them the tools to help keep them feeling good and being active and feeling their best. For me, this is a very personal journey. I will tell a bit more about the story in one of the next upcoming slides, but for me, I suffered from back pain for over 20 years, and sometimes we get handed those cards of why did I get handed this? Well, I think I was dealt this hand because it helped me continue to seek out, find answers, find missing links that oftentimes traditional modern medicine was missing, so that I can only help myself, but help our patients. So over the past 9+ years, we've been able to help over 1,000 people get access to this highly specialized care and improved outcomes. And we are very proud of our reputation of being able to help fix problems that oftentimes where other therapies come up short. Got over 110 5-star Google reviews from our patients, and then over 5 years running, being voted top physical therapist in Lake Country through the Lake Country Family Fund voting. So thank you for everyone for always putting in your votes, or is it right, put in votes. So with us, our practice, we do help people age 40+ looking for physical therapy in Delafield and beyond to really find lasting solutions, not only to aches and pains naturally, but we're looking at this so they can get back to their active lifestyle that they want without these medications, surgeries, injections, and all these other things that oftentimes are thrown into modern medicine treatments. So who is this class for? Well, yes, we know we're all here for low back pain and sciatica, but really we're here for someone who wants to get to the root cause of their problem, because we're looking at this as not just getting to the root of their pain. We're looking at this as someone who wants to be hiking on the trails, playing with their grandkids on the floor, being in the garden, playing pickleball, taking a bike ride, being able to sit comfortably for a long trip or at a show, and really just have confidence that your body's going to work for you as you continue to age. So if this sounds like you, a lot of you guys already shared your story though, but you have low back pain, pain shoots down the leg. You're told you have arthritis, degenerative disc disease. It's not a disease. We'll talk about that in a moment. Herniated discs, spondylolisthesis or stenosis. Even if you don't know what these words are, you may have heard these thrown your way at some point or another on your journey with it. If you've had acupuncture, meds, injections, and still hurt,
In progress.
if you want to be more active but can't due to the pain or you're afraid of making it worse
I got it on my phone if you want it.
Oh, can we get, or I'm going to try and get you guys to mute here for a second. Or maybe we got it. All right. Thank you. Or if you've been told you're just going to have to live with the pain. I don't know if any of you have experienced that in your healing journeys. That is a line that I've been told multiple times by multiple providers on my journey, and it still fries me to this day when people are told that. So you're in the right place. What you're going to learn tonight, what really causes low back pain and why you are most likely looking at it incorrectly, missing links that oftentimes are driving the back pain and driving you crazy, problems with imaging and problems with a number of the solutions that exist within our medical system, and then things you can do to start getting on top of this back pain right now. So a little bit more about me, Dr. Jereme Trunk, doctor of physical therapy for over 20 years, orthopedic and spinal specialist, advanced John Barnes myofascial release specialist. And as I mentioned, recovering from chronic back pain after suffering for over 20 years. So co-owner and founder of Balance Within with my wife, Sarah, and then just my life outside of work, father, husband, hiker, biker, and musician. So my story, just a little bit more about my background with it, is that I've had a number of injuries going back to even age 2, but the big one was that at age 14, I had a nasty ski accident, which was poor conditions plus poor skill, which is a nasty combination, where I broke my collarbone, but I displaced 3 levels of my vertebrae of my spine. I went to multiple specialists. I went to doctors, orthopedics, massage therapists, pain specialists, physical therapist, massage, like all these things that are in here with it. But I was just like basically told either you sprained your back, you're going to have to work through it. This is as far as I can take you. You're going to have to live with the pain. And so being told that at a young age, when you're thinking about if I'm in my 20s, and I hurt this much where I was living on daily ibuprofen for probably years, racking my stomach and just more so just bandaging the pain with it and thinking, if my body hurts this much now, what am I going to be able to do in a few years? Like, do I need a career change? Do I need to like honestly, like, am I thinking in a number of years, am I looking at disability? Like, I just wasn't sure what the future was holding. But it would hurt to take deep breaths for many years, which developed an improper breathing pattern, which perpetuated the problem, which you guys will learn about tonight as one of the missing links. And one of our specializations here, the myofascial release, we'll learn about that a little bit as well. But for me, it was one of the big unlockings of my body from release out of the chronic state and into the state where I can strengthen it and get on top of the pain where I can actually help keep it there. And on a side note with it, I truly have medically documented. My measurements went from 6'2" to 6'4". I can't guarantee that's going to happen to anybody, but because my injury happened when I was younger and still growing, I had compression in my spine, but when the compression was released, I had 2 inches left in my spine. So, but regardless though, it shows some of the power that can exist with some of these missing links. But now at this point, I do live a pain-free life day to day, no meds. I'm still a PT, still running strong here, still hiking, biking, still playing music, being a father and husband and all those good things. So, so with this, I always say I'm very lucky. You know, this is not everyone's typical journey. This is not a typical unfolding with it. So I say it's kind of like I'm a fine bottle of wine of that. The older I get, the better I feel in my body, which is a rare thing to say, but I'm very blessed to be able to say that with this. And so bottom line takeaway of this is that we all have the capacity to improve and feel good in our body, no matter how long this has been going on. So what I'm going to share with you tonight then is missing links that I use in my own journey, but at the same time, the same tools that we use to help a lot of our patients who are either just straightforward back pain or chronic and complex to help get over their back pain every day. I'm going to hand this over to Elise for a moment. She's just going to speak to a little bit about herself a little bit more. And then when we're going through the information, she's going to have some speak on the pelvic floor tonight.
Yeah, so I know I introduced myself to a lot of you, but for those of you who missed, my name is Elise. I am a physical therapist assistant at Balance Within. So I've been there for a little bit now, and my passion lies with orthopedic sports medicine, also with all the spine patients. So as well as getting into the myofascial and women's health and pelvic floor. So I'm here to support you guys all and to give a little bit more information on what I have in the pelvic floor world. But otherwise, I mentioned earlier, I'm joining you guys from a volleyball tournament currently because I am a coach for varsity volleyball. And I played for far too long, about 16 years of competitive volleyball or so. So have a lot of back pain that came from that as well personally. So it's very much a near and dear issue that I want to be able to help anyone who comes through the doors to fix, because it's no fun, and I understand that wholeheartedly. So love being here, love being a physical therapist assistant and being able to get people back to being whatever activity level they want to be at and get back to doing whatever they love. So yeah.
Thank you, Elise. Yes, and we love having Elise here, and so do our patients. So she is a wonderful team member here. So look forward to having you guys get a chance to meet her more and hear her speak a bit more tonight. All right. So let's jump in. Let's jump in. I also used to say like this looked like my cat, but we just lost our cat that looked just like this just a couple weeks ago. She was the sweetest thing ever. So it's always good to see just this photo up here because it reminds me a lot of our sweet cat Joplin. So getting into the low back pain. All right, so here are some stats. Low back pain is a huge problem. So we are not alone in this because statistically speaking, this is the second most common reason for visiting a doctor's office in the US. 4 out of 5 people will have at least one point in their life a debilitating episode of low back pain. And then with more so like in the age demographic of 45 to 64 with the highest rates of low back pain. And as of right now, the National Institute of Health estimates that over $100 billion is spent annually on lower back pain. I pulled this number a couple of years ago. It's probably well over this number right now. But for our practice, this is the number one reason people seek us out for our specialty and our practice for our outcomes. This is our number one specialty right here. What causes it? So there's a number of causes with it, but I'm kind of just putting in some of the general ones in it. So in America, there's no hiding the fact that we sit more now than we ever have throughout our entire evolutionary process as human beings. So we get stuck in the position known as chair. So we sit all day, or then maybe we do the wrong types of exercise. Like we're sitting all day, but then we'll maybe go to the gym and just lift a bunch of weights because that's what we were used to. But then maybe those weightlifting exercises are maybe loading the imbalances that we've already created and then start to perpetuate the problem, or maybe postural changes that come along with this. But the big thing is that these add up to one big problem, and that is mechanical imbalances. And we're going to come to that in a moment in these next number of slides as to why mechanical imbalances is actually a good thing in terms of when it comes to back pain, because these are the things that are correctable. But this is the stuff that usually will affect the muscles, the joints, the nerves, the fascia, which that's connective tissue, and then body alignment. So top 4 common causes of back pain, I put it in quotations because regardless, whether we were being told it's muscular or it's disc or it's sciatica, a lot of times the stuff we're going through tonight, it's all the same drivers that lead to one of these. So we don't just wake up one day and all of a sudden the body says, oh, I have sciatica, or all of a sudden I have degenerative discs. It's an accumulation of this process that gets the body to the point where things wear out. But this is the mechanical imbalances. So for looking at these causes, just a couple differences between them. There can be some differences, even though oftentimes the solution is very similar. But if SI joint dysfunction is something that you've either told you had, or just from a symptom standpoint, it's usually typically in the low back, kind of in the buttock area, kind of back side of the hip, usually one side, kind of worse with standing or climbing stairs or transitioning from sit to stand, maybe standing on one leg. or it may radiate into the thigh, but often not past the knee. It sometimes can, but oftentimes not. And oftentimes it's a big pelvic alignment problem. And that drives a lot of these issues too. We're going to get into that tonight, guys. And then sciatica. Nerves get pinched in the low back or in the glutes or the piriformis region with this. So a lot of times pain going down the leg, it's just kind of grouped in together as sciatica. It can still have some particular certain differences with it, but typically that presents with sharp burning, sometimes that electric pain radiating down the leg. It's that pinched nerve sensation with it. So numbness, tingling, muscle weaknesses, changes in the reflexes of the body, or sometimes like even like with just standing up straight is very hard for sciatica. So oftentimes worsening with sitting, coughing, sneezing, or bending forward. There's muscular back pain. So it can kind of be like more like a diffuse pain kind of across the back of the muscles there. Sometimes both sides where it feels kind of achy or tight, where like you have worse pain with like movement or lifting, or just being in one posture for too long. And so even though alignment issues can play into this, oftentimes the big thing is that the core muscles are just too weak. And then all the big muscles in that area, especially a lot of those muscles that we feel that are kind of ropey in our low back, they're working overtime. And then degenerative disc disease. And so they call it disease because from the medical side of it, they label disease as something that impacts like the function or like the ability of the system to do its job. So it's not like we get like a virus and all of a sudden then like we get disease of the spine and it kind of degenerates the disc with it. So we lose the cushioning of the spine with the disc with that. And then what happens on the other side of it is that you start to get more of that, not only spinal pain, but nerve pain with it. So this can be pain in the low back that could be referred into the hips and thighs, but it's kind of that combination of both. So it's oftentimes more of a chronic thing, oftentimes worse with sitting, bending, or lifting. And sometimes it can have some intense episodes of pain in the center of the low back. So the good news, based on research, and I would argue too, based on what is seen clinically, 90% of back pain is mechanical, which means that a lot of these things are addressable, guys. So that means like when you address your alignment and your stability and look at using the body as one unit rather than just looking at, hey, my back hurts or my hip hurts or my foot hurts, and just looking at these different parts of the body, looking at it as one whole unit because it's all one mechanism that works together. So, but even research backs this up. It's just that medicine has not followed suit in its treatment. Getting to the root of the issue. So typically this is like a common progression that we'll typically see and play with in a lot of positive outcomes. So if you were to come in here, what we'd be looking at is number one, let's get you out of pain. So let's look for decreasing muscle spasms. And we're using this through whether it be myofascial release or dry needling or cupping, pelvic rebalancing, restoring a little more symmetry, which is more so getting into that root causes then. And number two, restoring that symmetry and then restoring stability in the core. And we're going to get into this in the next couple slides too, guys. Like what your core is may not be completely what you think. Okay, so then from beyond there, we're strengthening into functional movements, meaning like full body stuff where you are putting weight through that body and allowing those things that we've been putting together piece by piece, getting it work together as one whole unit with it. So we like to look at it as saying we're building out your toolkit so you have tools for life. We're not looking at it from the standpoint of saying like, hey, it's just like, hey, come see me only when you're feeling bad. Like we get patients who come in for tune-ups with it, but really we want to give you empowerment. You want to be able to take care of this. You want to be able to, like, if you go on a trip and something flares up and you feel like you're stuck in a rock in a hard place, it's like, no, like let's give you the tools so that you can actually break that cycle, get back to your trip or back to life, whatever it is. And then just number four, long-term, just build a solid game plan together, just to keep you feeling better long-term, enjoying life, time with family, friends, activities. A lot of times for an individual, this could be like a home program, Pilates, yoga, gym, workout classes. Depending on what someone's goals are, we're going to tailor it specifically to that. But it's always about then just getting you into something long-term to really keep things together. Missing pieces. So the fascial system. This is a webbing that connects everything in the body from head to toe. So think of it like a cobwebbing that you can kind of see it in the photo there on both of them. One's an artist rendering, the other one's a true picture of it. It is basically a cobwebbing that surrounds, studies are conflicting, every cell or like every muscle fiber. Either way, it connects everything in the body with it. And so here's kind of like the tricky part about it. At its highest measured capability, this system can exert up to 2,000 pounds per square inch of compression in your body. It's almost a metric ton in a small space like that. And it's almost kind of like you can almost have like a straitjacket on the body. So oftentimes in response to traumas, whether it be big traumas like accidents, car accidents, large falls, or even smaller, what we say like, traumas, like just how we repetitively sit in one position or move a certain way. Sometimes this system can get bogged down a bit and has a high force capability at that 2000 PSI, but it does not show up on traditional imaging. No x-rays, no MRIs, no CT scans. So just because you have a scan doesn't necessarily mean, and they don't see anything, that there's not things happening. So everything is connected in the body. This is just a couple visual representations of some different fascial things. The one picture all the way on the right that shows kind of like a snag in a sweater where we can say like, hey, if someone had an injury to that right side of the body, sometimes those injuries can branch out into other parts of the body where all of a sudden like, hey, like, my neck starts bothering me, but like I had an old hip injury. Is this related? So this is just a little bit of that visual representation of how everything is connected in the body with this. All right, so show of hands. What kind of core do you want? All right, so this is one of my favorite slides, but just show of hands, just no wrong answer right now. Who thinks we need washboard abs for stability? Or just that's the goal. That's the goal. That's the goal of the fitness is washboard abs. Or who wants a can of Coke? Do you want that for your core? Like, what does that mean? Well, better question is, what kind of core do you need? Okay, so you need a core that can support your body all the way around, 360 degrees with top and bottom. So basically a canister shape. And when that happens, you can support and build your body all around this. So I love this picture here too. There was one lab study that was done that showed loading one of these sealed pop cans, and with equal loading, one of those cans can take 700 pounds of force before it even changes shape. So by design, a solid cylinder or canister shape is an incredibly strong structure, and this is what we need to be building our body around. And really what makes up our core, okay? So a lot of times people look at that washboard, they look at that muscle on the outside, like, see like the guys at the gym or on TV, like, of course, like the athletes, you see that. But here's the thing is that it may look good, but there are times, and we've seen this in here before, just because someone has a six-pack abs does not mean that all of a sudden like they have a great strong core, because what happens is what matters underneath. If what happens underneath isn't doing its job, the balancing act is thrown way out of whack. So the deep core on the top part of this, it's our diaphragm, so our breathing muscle. In the middle part of it, it's called transversus abdominis. It goes all the way around like a corset or a girdle. And then at the bottom are the muscles of the pelvic floor. Those three together create our deep core. So a lot of times for people who have done like crunches and ab works and like, core stability classes, and they're like, oh, I can hold planks for 2 minutes, but are still in pain in their back. It comes down oftentimes to this being one of the biggest imbalances or dysfunctions in their body. So what does this mean? So I just mentioned this before. Six-pack abs and washboard abs does not mean you have a strong core. You need a core that can stabilize with a canister. Otherwise, you will be overstressing your spine, your discs, and your nerves, and actually other parts of your body. It affects all the other joints with that. Your hips are big ones with this. Your hips, the knees are oftentimes the two easiest ones to pick on with that. But regardless, even up the chain into our shoulders, this can still impact it. So with this, one of the big takeaways from tonight knowing that part of your core is actually your diaphragm. So how you breathe and then also how you align your body will greatly impact your spine and the rest of your body. So just on the pictures there, you can see a properly balanced system with that, where the top and bottom and sides all kind of equally pressured there. And then on the other one, when our bodies start getting out of alignment, we start getting these abnormal forces in there, meaning we're putting more pressure on our back and our spine. And then even in other cases, this is where we might have maybe hernias or diastasis recti or pelvic floor issues with this. This is all interconnected, guys. This is all one and the same. So as I just mentioned, breathing wrong, and it's hurting your spine and your neck, your joints, your digestion, and even increasing your stress. So the diaphragm, it is your primary breathing muscle, but it is also one of your primary core stabilizers. So oftentimes, if you're trying to work your core, but you are improperly breathing, you are taking a huge chunk out of that core stability with it. And your body alignment and your stability often go hand in hand as well. So this is another common photo that's almost very similar to the other slide with that. When we kind of go into different positions, things start getting pulled apart. This is a common posturing. It's not everything that's the imbalanced one with that. Like there are other presentations that still put abnormal forces on it, but we're trying to get more into a better alignment with it. So get your breathing better and getting your core working better as one whole unit so you can build your body safely around that. So foundation to your body. The pelvis and the hip and lumbar spine. It really works all in hand. So in the medical world, they'll look at this as the lumbo-pelvic hip complex. So as I know I'm saying, like everything connects in the body, but in this particular portion of it is a lot of connection with it. So I love using this analogy because it really rings true for the body, but just like the home, if you have a foundation that's level and stable, the foundation will allow the rest of the body to work better together. Same thing in a home. And the body, if we get a misalignment, that could be throwing things off into our neck, into our feet, of course, into our back. In the house, well, that might look like windows are getting sticky, doors are getting sticky, cracks are getting in the walls. We got that foundation sinking or moving on us. But even research shows up to 90% of people with pain anywhere in the body will likely have an uneven pelvis. I'm going to pass this on to Elise. She's going to do just the next 2 slides here because we're talking about the bottom part of the core and in the pelvis. So we're going to talk about the pelvic floor a little bit for the next couple slides.
Yeah, so just as Jereme was saying, with the foundation, the pelvic floor is truly the ground of that foundation. It is, as you can see in the picture, all those muscles are right underneath the pelvis that he was just talking about. So, and these muscles can be too tight, tire out too quickly, too weak, or just struggle to relax. It's something where, sometimes we don't always realize where we're holding tension, and that can be a main area and we're just not aware of it. So working to retrain these muscles can help support the rest of our body and our back specifically in a huge way. And it's not as hard as it sounds. So we can definitely work through a lot very quickly with retraining that pelvic floor to support the rest of your body and really be that strong foundation for you.
Right.
And then just a couple of signs to see if your pelvic floor muscles are maybe working as best as they could. And, this is for males and females. So guys, don't check out with this. It's also a big thing with males as well. Urine leaking, urgency, increased frequency, pelvic pain, constipation. For the women, C-section scars can be a huge driver of that, and just not being able to activate properly. Diastasis recti, which is abdominal separation, feeling of heaviness, like we were talking about today, back pain, hip pain, also though all the way up to jaw pain, headaches, and neck pain. It really connects all the way up. I've already had some patients who we've done some pelvic floor work, and their migraines that they've had have lessened, which is they're always surprised about. And it's always great for me to hear because that means we're doing the right thing. And the good news is you don't have to live with it, especially for women who, you have kids and you think, oh, I just pee when I sneeze. No, that does not have to be the constant anymore. We can fix that. And it can really help with so much else in your body and really be that strong foundation you need for everything on top of it.
Wonderful. Thank you, Elise. Yes.
Mhm.
So yes, just that combination of just how everything works better together. Who thinks about their pelvic floor influencing their headaches? It's just amazing how the whole body works together. So just other missing links, like these, we just say the usual suspects, because for some individual, it may only be a couple of these things, but for some of you who maybe had some of your therapies that have targeted just the back, these are sometimes some of the other pieces that are missing with it. So we talked about fascial system, we talked about pelvic alignment, we talked about breathing. We didn't use the word much yet, but like pressure management, of really just making sure that we're not putting too much pressure on one side of that pop can and pushing things out. We talk about the deep core, make sure like it's coordinating properly, meaning that if we're just trying to just get all the big muscles, if we're just doing, again, I like going back to this because this is so common. I can do a 2-minute plank, but my back still hurts. Well, then there's something that's still not working well with this. So poor movement patterns or body mechanics, even our upper back, lack of strength and mobility in our upper back will absolutely play a role with that as well. Seen it many times from the bottom up that something goes wrong with the foot or the ankle. And maybe sometimes like someone had an ankle sprain 10 years ago, wore a walking boot, and then a few years later started developing back pain, which seemed kind of just strange that their back started bothering them. Whether it be then inadequate strength in the hips or just poor posture, tight hip flexors, pelvic floor tension. So anyways, these are the things that we really want to look at if you're looking to get to the root of the issue with it, is just making sure we're looking at the full body with it. And again, for some individuals, it's only a couple of these things, but for some people, it might be the opportunity for them to be really in the difference of long-term ability to use their body or not, of being able to take a bigger picture approach with this. So with all our pieces needing to work together, it's amazing that we're not, when I say insert body part here, we're not a neck, a shoulder, a back, hip, knee, ankle, whatever, working in isolation of each other. So really, like, why does so much traditional medicine really take that approach when even though all the research shows that this is all an interconnected system? All these high cost things, it's all isolated approaches, not all, majority. But here's the kicker. Information is just as applicable to jaw pain, headaches, knee pain, hip pain, shoulder pain, pelvic floor dysfunction, and almost any other problem in your body. And sometimes the question is, well, like, really, what came first? Like, why did this happen? So whether we're saying it's a foot problem, whether it's just, I sat for a long time, it doesn't really matter really at that point in the game. It really matters is that you're looking at enough pieces of it to put it back together. So that's where I really don't, unless it's something that someone's still currently doing and we need to stop that, but most of the time it does not matter which came first. Common questions people have: should I get imaging? Have I tried everything? What about surgery, injections, painkillers? And the deep questions, the philosophical ones in life that'll keep you awake late at night. How do we know that new dog food has an improved taste? How can they really pitch that? Imaging. Should we get imaging? It's got its place in time. Average cost of an X-ray, 100 to 1,000. Average cost of an MRI, 400 to 5,700. Research shows that 60 to 70% of adults with no symptoms have abnormal findings on imaging. I do have a slide that shows those numbers. And then the joke in the medical world, MRI stands for might reveal injury, because really sometimes what you see on there and what you feel are way two different things. So options after imaging, though, they're usually meds, injections, surgery, or thank goodness, therapy. Oftentimes, though, if someone gets imaging done, therapy will be recommended anyways. So sometimes people come to us, they ask us, should they get imaging? Oftentimes the easy answer is, unless they're like in debilitating pain and what we're doing is not helping. But most of the time they say, hey, let's just get after this right now. If it feels better, you saved your money. If we're doing this and it's not getting better, let's just make sure we're covering all our grounds on this. Most of the time, though, it may not be needed. So, as I was just saying, you are not just a label from an image. Okay, so this right here, just the bottom line summary of this, we'll just say that the study took 100 people, no symptoms in their spine, and did an MRI on them and showed these were objective findings on it. So, for example, disc degeneration, age 50 plus, 80% of the people MRI'd at 50 plus already have disc degeneration with no pain. 60% have disc bulges, no pain. And then even as we get even a little bit lower with this disc protrusion, where it's coming out a little bit more, at times that disc can hit the nerve, but it doesn't mean everything with it. So in this study here, 70 age people, 70s and 80s are falling in the 40% range that disc is coming out, but it's not producing pain. So it's very eye-opening to see these studies of really what you see on an imaging and what you see in the clinic does not always match up. So, I don't want to demonize this stuff. There is absolutely a time and a place for all these approaches, especially for an excruciating pain. You can't function, you can't sleep. Thank God for modern medicine, for real. Like it's there for when we need it. It can serve as a bridging of a gap between where you're at for symptom relief, but then getting to the root of the problem. So, but here's the thing, like average cost of each spinal injection is $4,000 and it's a temporary fix. Average cost of a spinal fusion in Milwaukee is different between each major city, is about 70 grand. And I think this was from 2 years ago. My guess is it's probably about 85 right now would be my minimum guess with it. And the rate of success for a spinal surgery, at best, flip a coin, 50%. And oftentimes these approaches are bandages and it can be a matter of time before the pain returns. So another way to look at it, what if you're driving your car and your axles are out of alignment? You're going to be putting more pressure on a certain wheel or a certain tire. If you just say like, hey, I blew out my tire in our body, I wore out my hip, I wore out my knee. Okay, let's put a new tire on that car. All right, great. But we're going to get back on the road and drive it, and it's still out of alignment. Oh man, so what's going to happen? Okay, well, that joint's going to wear out too. So modern medicine says, hey, you're out of alignment. You need a new spot here. Let's put something new in there. At times we need it. At times we do. But unless you're getting back to realigning things, you're just going to keep dealing with a lot of the same issues potentially, in the long run with this. So I just want to have that bigger perspective of not always going where it hurts to fix the problem with it. It's more than just that. So in summary, your source of your pain is not just where you hurt. Majority of low back pain is mechanical. This is great. This means that a lot of this stuff is modifiable, guys. Research shows up to 90% of this is mechanical driven. So, and there are multiple factors that contribute to low back pain, and every person's body is a bit different, but still the stuff we talked about already, these are a lot of the usual suspects that are missing links that are missed in a lot of traditional in-network physical therapy places or chiropractors. There are some people who are getting phenomenal results out there. Thank goodness, like I want this profession to be known to be a go-to place for problems that people can go to a physical therapist when something goes wrong with their back rather than just trying to go to an orthopedic instead with it. But regardless, though, there's still a gap that needs to be closed, in my opinion, with this. But regardless, though, we got some tips to help you get started. This is just the beginning with it. And we're here to help you whether you choose to work with us or not, okay? So really, we just want to make sure that we're helping people get back to feeling better, enjoying life, not having to rely on meds and surgeries. It's really what we do best. But regardless, we're here. You pick our brains. Use this as an opportunity to get some answers in your care and in your journey with this. 5 tips to start feeling better now. The PDFs will come out, will be sent to you, but the one that's probably gonna be easiest because we're doing this virtually right now is going to be talking about breathing. So since you guys will get the exercises, I'm going to at least talk about the breathing rather than trying to really demonstrate on video all of these different exercises with it, because the breathing is something that already you can start immediately to start at least getting your core working more, supporting your spine more, and being able to just start training your body to work differently with its stability pattern. So when we breathe, we'll use this one. So when we breathe, really our rib cage where I have the belt should expand 360 degrees. Think like an umbrella opening. When you open that umbrella, it opens up and all that full circle with it. This exercise right here is just a great way to kind of just feel this, how's it moving together? And maybe that's going to be as particular saying like, hey, you move good on the front, but you're limited in the back. It's just, how is this whole thing moving together? Just you wrap a belt or a towel or something around just your lower rib cage with it. And even right now, actually, as you guys are sitting there, actually, well, we'll do it on the next slide with it, but I'm going to have you guys take a breath in a moment. And I just want to just have you take note of what you feel with this, because it's so commonly found with how this misbehaves with it. We'll use this one. This will be a little bit easier because this person's sitting and you guys can do this right now in front of your computer or your phone. Just do this right now. Put one hand in your, kind of like your upper chest, kind of lower neck there, and one hand kind of like right where the rib cage kind of veers off, just kind of like right where the chest plate comes down and where it starts going into your belly, that upper abdominal area, and just the hand here. And just take a nice slow breath in. And out. And just do it one more time. Take a really slow breath in. And out. So what did you feel? Well, deep breathing is great for relaxation, and it's good to kind of just take a few cleansing breaths. But did you feel your upper hand move more or your lower hand move more? That's a big thing right there. Most people we're probably going to find are going to be breathing more with their upper hand and feeling that move versus their lower hand. If you felt that, I guarantee you part of your breathing is part of your problem if you got back pain right now. You're not using your diaphragm as much as it really could be used and needs to be used with it. But this is an easy test you can use, and even an easy exercise one can do as well to start just breathing better with it. I always recommend at least a minimum breathing for 5 seconds in and 5 seconds out, because quick breaths, it's not necessarily our best friend if we're trying to retrain this diaphragm to move more. So just a little quick glimpse though. Again, if you're here for low back pain or hip pain, whatever it is, if you took a breath right now and you felt that upper hand move more, your diaphragm is part of the problem. Posture, nice, good standing stretch at the counter. Kneeling stretch. Again, these will be sent to you. These are a little bit harder to demonstrate over video with it, but these are a lot of the basic ones that can often help open up the low back. But again, sometimes certain bodies will have certain specific imbalances that sometimes these can really help. Sometimes they just don't do the trick with it. But oftentimes these are easy go-tos to start making some positive shifts. Just 4 more free tips here with this. Just breathe through your nose as much as possible. There's a whole rabbit hole of breathing through your nose versus breathing through your mouth. But the bottom line is, based on tonight's information, it helps your diaphragm work better. For those who are dealing with like chronic muscle pains, aches, and discomforts, hot or cold, if it's a new injury, you fell, you twisted, you tweaked, something kind of popped on you a little bit, ice is great. If it's a chronic issue, typically heat's going to be a bit better. When we have really chronic issues, we get a lot of tight tissue. Putting heat on there opens up that circulation, where ice, even though it helps with inflammation, constricts the blood vessels. So oftentimes heat tends to work better. Get on up and move. Really recommended 2 to 3 times every hour is the ideal recommended with it. So every 20 to 30 minutes, even if it's for 30 seconds, what they would consider micro breaks, just a small break in that positioning helps kind of your body just break out of that accumulation of getting stuck in the position known as chair. And then just overall move more, reduce stress, anxiety, improve your sleep, well-being. So walking, hiking, biking, just get out in the yard, do something. If you can't move because of pain, then your body's asking for help, and it's time to listen to it. 2 more tips. You're all awesome for being here. Truly, thank you for everyone who came here tonight. You got this, okay? Just gonna share a couple quick stories, and we're gonna open this up to questions. So these are real patient stories here. So this was a 68-year-old retired grandmother, back, hip, and knee pain, also some foot and neck stuff, but the back pain was the kicker that brought her in. She watched her grandchildren 2 days a week, and at the time she had a 10-month-old and 3-year-old that she was watching. She liked to garden, bike, and she was hiking and traveling, but was having back pain with pretty much everything: standing, sitting, sleeping, lifting those heavy grandkids. Heavy grandkids, remember, guys, heavy grandkids will always be the lightest they are today, okay? So the breaking point for her, though, was a bike ride that laid her up for 5 days. She couldn't barely get out of bed for 5 days, and then she went in for 2 rounds of spinal injections. Each one had 1 week of relief, and then the pain all returned. Tried acupuncture, tried massage, each had some temporary relief of a few days, and then all the pain returned. With her, we came in significant pelvic misalignment, and her core was not firing with this. And so those were 2 big things that really got out of pain really quickly with it, but then getting her a little bit more over the hump. There was an old ankle injury from about 30 years ago, which opening up that foot and ankle so that when she walked, that whole leg can move a lot smoother. 6 months after this, she's traveling, lifting grandkids, biking, hiking. Everything is feeling much better. The only thing is she has arthritis in the knee, so that still fluctuates on her. But overall, she has done phenomenally well. This one is near to me as well, because just in terms of like, I know some of like the age range, like some of the older ones here, we don't sometimes think about some 40-year-olds who are being told they need spinal fusions. Well, this was a case right here. So 44-year-old teacher, this had extreme back pain for 4 months. So this gentleman cannot stand for more than 5 minutes or walk without dragging his leg behind him. When he walked in here, it was just one of those, like, almost if you see someone acting and they would walk and that leg would just drag behind him. It was like all that oomph with that, except it wasn't an act. This was his life with it. And so this was a gentleman who was a golfer, softball player, hiker, and musician with it. He had already done, by the time he had seen me, was 18 rounds of PT, 10 rounds of chiropractic relief, 2 MRIs, 3 rounds of spinal injections. And because he had no relief, he was told that his next step was spinal fusion. It just baffles me that just taking just one small step back, resetting his foundation, resetting symmetry, getting his core, within 3 sessions, he had said his pain was 90% better. So every person's going to be different, but this is the power that exists when you actually look at things at a bigger picture with this, guys. This is not just like, hey, like I saw this on an MRI, like I have a disc bulge, this is where my pain is coming from, so let's go after it. This is where reset that symmetry, get that core working better. 2 years later, following up this individual, fully playing softball, still in an adult league, still golfing, no pain at all, no surgery. And then just a couple Google reviews. This one right here, they're up on the screen there, but I don't want to mess with the recording, but I'm pulling up right here. We got 2 Google reviews in the past 2 weeks, and these were both from individuals who were just at the last masterclass we did with this back in April. This is just such a phenomenal just testament in terms of how these people have gotten a differentiation of care with it. So I'm going to try and read the highlights. I wanted to put it in here, but honestly, it was too long to even fit on a slide to read with it. So I'm just going to give the highlights. Over the past year, I've undergone traditional physical therapy for persistent lower back pain and hip pain. I was measured, evaluated, sore areas were massaged. I was given various exercises. I suspected some of my problems might have been alignment, and I voiced this to my therapist, but she didn't really address this to my last appointment. And when she acknowledged I did have an alignment issue, she explained that different therapists have different ideas about how alignment affects back pain. After 21 visits over 5 months, no significant improvements, my therapist recommended injections for pain relief. At this point, injections seemed like a Band-Aid. I'm in my 70s and will do all I can to stay as active as possible. I love taking care of my home, walking, doing yard work, gardening, and then my back-related issues were making it increasingly hard to do this, as well as posing a real threat to my mobility going forward. When I scheduled an appointment with Balance Within, in a short amount of time, working their magic on me, They help painlessly correct my misalignment and other painful areas through myofascial release techniques that help relieve the tight spasming areas that were causing me so much discomfort. Also giving me targeted exercises to strengthen the muscles that support these areas, to include my back, legs, and hips. In just 8 visits over 3 months, I am virtually pain-free and realizing renewed flexibility and strength. I can now once again enjoy these activities before I couldn't. I used to wonder what it felt like if I could ever feel good again, and my thorough recovery with my treatments, it feels like a miraculous gift. And then one other quick one. This was the other one from the masterclass from last session. Came to Balance Within after 9 months of dealing with 2 separate back injuries, on and off success. I'm an active cyclist and skier, Nordic skier, was seeking a more systematic approach with the goal of pain-free activities. Balance Within was the right choice. Their approach makes a lot of sense and worked well for me. First, deal with the immediate injury, then analyze my body as a system, find the imbalances in muscle activity, and then third, work on exercises to rebalance and strengthen this system. By the system, I mean my feet, my legs, hips, and back. I learned a bunch and it worked great for me. After about 6 months of 10 sessions, I am pain-free and feel I have the foundation to continue strengthening my core. And Balance Within has taught me a bunch of useful exercises that I will continue to use, and this is the most valuable part of the treatment. So, tools for life, guys. Learn how to take care of your body. Really, get out of pain and learn how to take care of yourself for the long run. The one gal is in her late 70s, and the other guy is in his 60s. So you're not too old, you're not too broken, you're not too far down the path, okay? All right, and coming up soon. So for those who stay here till the end, treatment session for a free treatment session. We're going to do the drawing once we find out who everyone was here. We're going to either reach out tomorrow or Friday at the latest who the winner was. But for those who stick around, though, you're going to be in that drawing for that free session, okay? What's it like to work with Balance Within PT's team? Kind of touch base on it, even just in those reviews right there. So we do 55 minutes one-on-one. We do a full body assessment. In that evaluation, we're assessing where are the quick wins, where are the things we can make the quickest shifts that are most readily apparent. Learning, and then we're really learning what your goals are so that we can really make sure we're directing this plan of care towards your goals. We'll do hands-on care to give you a boost to start feeling better quickly, and make sure that whether it be myofascial release or soft tissue work, cupping, dry needling, regardless, we're trying to get you feeling better as quickly as possible. And then we're giving you a tailored home program for your body. This is making sure that you can handle all of life's fluctuations and keep you moving towards your goals. As I mentioned, this isn't looking to be just only come in here just so you can feel good with us. We have patients who come in for tune-ups though, but we really want you to be able to take care of yourself in the long run. That knowledge really makes a difference for that long-term, that long-term gain of being able to actually live your life. So tools for life, help keep you feeling better and living your best life. 3 options, which one fits you? If you want to put it in the chat, you can. Otherwise, you can still even reach out to the clinic as we're going to have some other options with it. But there's 3 options right now. You can still, you can put in I'm ready, which means I'm ready for an evaluation, which is getting to the root of the problem and more so looking at the more thorough evaluation, hands-on treatment, customized exercises designed specifically for your body, and just ready to start getting into this now. For some people, you still might need to explore a bit more. Totally fine. We have discovery visits, and this is where you're just curious to learn a bit more. For a free 20-minute session, just get to ask some questions, get some clarity, meet one of our specialists. It's no treatment yet, but it's just a conversation really to see if this is the right next step for you. And not quite ready, you can keep exploring. If you want to still keep exploring on that journey, no big deal. Really, we're here to be a resource for you guys, just like this presentation. Of course, we're letting you know how we can help you, but really the main purpose of this is really to help and educate and really just make more of an impact in people's worlds with this. So again, no pressure. Our goal is to help you feel better, live better. If we're not the right fit, we'll happily guide you to someone who is. Masterclass attendee exclusive for scheduling an evaluation or free consults. So you are going to unlock the access to turn back the clock pricing, unlock our 2022 pricing. So before all this inflation hit our world on packages, orthotics, never be a better price on these products and services. It will never be cheaper than this. So treatment packages, custom orthotics. For you to be eligible for this, you'd have to connect with us we're giving you by the end of next week. So next Friday is October 3rd with that. So if that's something you would like to lock in for just being here tonight, we really want to make sure that for those who really took time out of their day, you guys get something special as an option with this. So this is here for you, okay? All right. And then thank you for being here. And where's my man Elvis? Oh, thank you. Thank you very much. So